Hello and welcome to 60 Seconds. I'm Bob Jones, and today we'll be talking with the famous doctor, Dr. Don Francis. Okay, let's get to the questions. Which illness did you help discover? I helped discover the HIV and AIDS illnesses. The CDC, which I'm a part of, Dr. Bob Gallo of the Cancer Institute, Bill Krause, and the French were also involved. How were the French involved with this disease? Well, the French also found the disease in October of 1983. And I helped them by sending them some samples. And they actually found that the infected cells died when they touched air. But Dr. Bob Gallo gave my lab some turbulence because I helped them out. Not to question your career, but what kind of experience do you think that you had to make you qualified for the position that you were in? It's okay. I was qualified for that position because of my previous work. In the beginning of AIDS, Ebola, I worked on that, and it was in Africa, and I also worked on hepatitis B in males. What are the HIV and AIDS disease exactly? Well, they're actually technically the same disease. HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immune Deficiency Syndrome. Basically, HIV starts AIDS, and AIDS destroys the immune system. Once the immune system is not functioning, other illnesses are able to come into the picture and help kill the victim. Where were the first cases of the disease seen? The first sighting of the disease was in Copenhagen in 1977, where I actually had to watch the woman die from the disease. The second was in the Claude Bernard Hospital in Paris, France in 1978. Who were the majority of people that were affected by the disease? Yes, homosexual males were the first population to get this disease. This disease was being spread sexually, mainly in bathhouses. People could also get the disease because of unclean needles when getting tattoos. How else can the disease be spread? The disease is spread through all bodily fluids. One that I already mentioned was semen, but others are vaginal fluids, feces, urine, blood, breast milk, tears, and saliva. But it's very hard to get the disease through tears or saliva. Who was Bill Krause, and what did he stand for? Bill Krause was a homosexual congressman, which was like being connected to two sides of a war. In the 1980 Democratic Convention, he asked for gays to be treated as human beings, because at the time people thought only gay men had the disease. As you can tell, people were very prejudiced. He also urged for people to have safe sex and to prevent the disease, but ironically, he became diagnosed with it in 1984. He died 2 years later. How did patient 0 spread the disease? Patient 0, or Gatu Dugas, spread the disease sexually. He did not know he had the disease. Instead, he thought he had skin cancer, until told otherwise. 40 cases were linked to him. How difficult has this experience been? The experience has been frustrating. Many times I have lost money for labs because of people like Bob Gallo making things complicated. Also, a lot of people I've been working with aren't doing this to help the people, instead to get money. Also, the case's death rate has been intensely rising. How come the people voted against the use of the hepatitis B test to protect the people from the virus? There are two main reasons why people voted against the test. One being that it was expensive, the other was because it wasn't 100% accurate. Thank you for your time, Don. This has been 60 Seconds with Bob Jones. Good night.